A cell phone technician comes to your office with a sports-related injury he sustained while playing flag football with his nephews this weekend.
Sounds like you.
The script from his, I got one nephew. The script from his PCP reads: extreme left knee pain, evaluate and treat. Assess soft tissue integrity. Upon interview, the patient claims that he twisted his body on his planted left foot when avoiding one of his nephews, but also remembers being hit on the outside of the knee. First question prompt is: what structures might be affected based on this patient's report? We have,
all right. Yes. So what? Based on the patient's report, what structures might be affected in the knee?
ACL, MCL, medial meniscus.
ACL, and that's known as what?
The miserable
Unhappy.
3.
The unhappy triad. Very good, because external rotation of the tibia on the planted foot, right? That could be tear all 3. Also, he had a valgus directed force. That could be MCL. So these 3 therapists don't know what the patient's diagnosis is. So therefore, they must do special testing for all of the 3 of the miserable bowel alignment. What are we doing first?
So the first one that we're going to look at here is the MCL.
All right, do it so that either Kat gets up or you.
That's fine. I'm
All
going
right.
to this side. Would you rather be on this side?
Attitude.
So we're doing MCL first. Let the audience look also.
Yo,
Audience.
come on,
On the
come
other
bite.
side.
Come on, guys.
This is called the valgus stress test.
The valgus stress test. Good. So you first start patient in full extension, and you provide a valgus directed
Or
force.
medial on the ankle, lateral here, and we're just
Good.
pressing through here, and you would be able to feel.
So if you have very little movement or no movement, very little pain in full extension, that is probably what? A grade 1, 2, or 3 strain.
1.
1, because
feel
extension is the closed pack position. If you have a minor sprain of the ligament, right, then you're not going to have much movement on the medial side because it's in the closed pack position. Does that make sense? Yes or no?
Yes, sir.
Good.
The next variation
Yes, go on.
is the placing the leg into 30 degrees of flexion. So to do so a little bit easier is you can bring the leg off the table, bring it to about 30 degrees, bring it to about 30 degrees,
Yeah.
and then it's the same motion. And test.
Good. So if they have no laxity in full extension, but some laxity and painful palpation in 30 degrees of flexion, that is a what?
Grade 2.
Grade 2. That is right. Thank you, Eric, for not even this group.
Oh,
Right? Because full extension, closed back, no movement, 30 degrees of flexion, open pack, some movement, that would be a grade 2 tender palpation. Very good. And a grade 3?
They're both positive.
Grade 3 is bad. They have instability in 30 degrees, fine, but they have instability in full extension. That means the closed pack position doesn't even help them. That's a full rupture or grade 3. You should definitely know the difference between sprains versus strains. Sprains are ligaments, strains are muscles. Strains are also patients. Add that to your book. All right, good. So MCL, you did your MCL tear. What's your MCL testing? We're going to say in this case, MCL testing was negative.
Yes.
What are we doing next?
ACL, right?
Minute.
Let's
Oh,
do meniscus next.
Sorry.
It helps build up the
Mírame. Mírame.
suspense. All right.
Where's the script?
So we actually did these the other day, but we're gonna do them again. First, we're gonna. Yeah, you can sit. Yeah, take 1, 2.
What are we doing first?
We're gonna do the McMurray.
Oh no.
Oh, just the one.
Just nothing wrong,
My bad,
please.
my bad.
So that's the
Sorry.
bringing them here. We can do internal rotation first if we want, because it doesn't matter what you do first, and then you extend the knee, and by doing that, you're putting the lateral. You're giving the lateral meniscus stress.
So you start 90 degrees, you either internally, externally rotation.
And now we're gonna do external rotation, and that's gonna put the medial meniscus on stretch, and then we're extending the knee.
Good. So you see how you isolate those two? Good. Any questions on that? We're good? All right, that's McMurray. What's the next one
Flip
you're
on
going to
your
do?
back, we're gonna do the athlete. Can you scoot over just a little bit to your right? This is like a grind test, putting
Everything's a grind.
force through the knee, and we're just doing internal and external rotation.
Tibia on femur. That's the
Yes.
same thing as all the grind tests, right? And a positive sign is what?
Ouch.
Pain or excessive clicking,
Or
perhaps?
clicking, yeah.
And the
then
third special test?
this is the standing one. It's called the what is it?
Desolate.
Decilate. The patient stands, you can hold onto my forearm, and I'm just gonna ask you to bring your right leg over, cross behind you, and then bring it out to the side. Mhm.
Right, and that works the meniscus, right? It's grinding the meniscus, right?
Mhm.
A positive sign is what?
Out.
Excessive clicking or pain. Very
And
good.
pain, yeah.
We're gonna say that all those tests were negative.
Mhm.
Finally, you need to test what?
Switch, around the other two.
Sure.
We're gonna do the left leg just for the camera. Hey, ven aquí, por favor. Come, mira a mí.
Alright, ready? So the first one is the anterior draw.
Ah, yes, knee is flexed to 90 degrees, and you see the therapist protects or blocks the foot, otherwise the foot's gonna fly.
And
He
then-
puts both his fingers behind the popliteal fossa, both on both hands,
And
and
then-
does an anterior draw. The name is great, it tells you exactly what you're doing. The video might be just misleading, or the GIF or the GIF. You're not pushing posterior, you're just bringing it back, you're pulling for anterior draw. You're doing both sides, and you're looking for excessive translation of the tibia and the femur.
Yeah.
And this
So-
patient, whoa, you're able to bring her tibia to Jersey.
Yeah.
All right. You do another special test.
And this one is gonna involve slight external rotation of the ankle.
Vamos a check. So también hay mixed up.
No, just making sure, just making sure. But you'll go through this, because there's another one I gotta show you. So this is the lock monk. And what we're gonna do is.
Or Lackman if you're from Brooklyn.
Same thing almost. She's in 20 to 30 degrees of knee flexion. And then we just do a quick thrust upwards. She's also in slight external rotation here at the tibia.
Yes, and you do it, you have the patient relax, because you don't want them to start flexing their quads to fight this, because then you'll get
So we check
a
if that's
false
relaxed.
negative, and you just,
Oh,
without
okay.
her knowing, you do a quick upward thrust.
Look at that.
That's good. That's good.
Good, excellent. All right, what's the last one?
I missed the joint because of you.
What's the last
The
one?
last one is called the, let's check in just to make sure I get the name right, the pivot shift test.
Pivot shift test.
So what this involves is, she's gonna be hip flexed, you can relax.
Hip is flexed at 20 to 30 degrees, that's way too much.
Do I need to, oh yeah, that, sorry.
Yes.
So we're here, and then I'm gonna internally rotate her at the
Knees
table a
in
little
full
bit.
extension.
And then, yeah, extend her while I apply valgus force and extend her. So we'd be like this. Yeet.
No, so you start with the knee in full extension.
Oh, yeah?
Internal rotation, and put your hand underneath, and you slightly bring it into flexion, and you're looking for posterior translation of tibia and the femur.
Yes.
Though this
Go
patient is wearing
posterior.
pants, it's not ideal.
I know. Sorry.
It's all right.
Pretend.
You're looking for the tibia to sink down, because in this position, the ACL keeps the tibia up. If the ACL is ripped, it's gonna start
Yeah, it would start falling on my hand.
falling posteriorly. Does that make sense?
Yeah, for sure.
All right, and all those tests happen to be positive.
Yeah,
So at the end, you figure out that what is the diagnosis?
ACL.
ACL, so is it isolated or is it, yes?
So the whole thing.
All right, so based on the above special test, you refer the patient to the orthopedist. Image reveals isolated ACL tear, and the team has to decide to treat the patient, they decide to treat the patient conservatively, not go for surgery. What two pieces of information that lead you that conservative treatment is good for this patient?
Swelling of the entire knee joint first.
No, but what lets
No.
you know that conservative treatment is a good choice for this patient?
The age.
Huh?
Lifestyle?
Patient's lifestyle is one of them. What's another one?
He's also young. I don't know.
Oh, we wrote-
No, it's one other thing. It's
We wrote on it.
lifestyle and the fact that it's isolated.
Sorry.
Thank you, Eric.
Oh, sorry.
Isolated, right? If it's isolated, if it was the unhappy triad,
Yeah.
then the patient probably would need surgery because you have to fix three things. If it's an isolated ACL and due to this patient's lifestyle, conservative treatment is good for the patient. Good. You are asked to look at the patient to see if they're a good candidate for conservative treatment. But before you could answer that, you tell the team, I cannot evaluate yet because what is in the patient's way?
Swelling.
The patient has swelling. What else?
Pain.
Pain. What else?
Decreased knee roll.
Decreased knee range of motion and quad weakness, right? Because when the ACL gets ruptured, automatically does quad weakness. So you really can't see if this is a good person for the job. So, how do you treat all of them? This is discuss how you set easy different parameters to strengthen the patient's quad. Tell me some things you would do. This is the modality section.
So it's gonna be Russian stem.
Russian stem, good. You set the intensity to
The intensity would be
Strong
until you get a
tetanic.
strong tetanic.
strong tetanic contraction.
Or
Where would
max tolerated.
max tolerated? Thank you. And you would put the two pads where?
One up here and then one.
One lateral, one medial. Remember those days?
Yes.
That's a long time.
Ooh.
Very good. Very good. And you would ask the patient to make a strong tetanic isometric contraction because they have quad. Very
So
good.
like quad set
2
really
weeks
good.
pass, and the patient no longer displays the above-mentioned impairments. Congratulations. Good work. Guys. What criteria would make this patient a good candidate for conservative management? Test
For-
this patient.
For
So,
single leg hops.
so test the patient. Who's the patient?
3, 4. Great job, patient.
Yes, if the patient can do 5 single leg hops, why is single leg hop a good test? What does the single leg hop do to the tibia on the femur?
Compressive forces.
It does an anterior. You're asking the tibia
To shit out.
to anteriorly translating. If the patient is able to do it without the knee giving out, that's a good sign. What's another one? So it's 4 single leg hops. What else?
Make sure there's no other soft tissue injuries.
No other soft tissue injury, and what else?
If they self-report like more than one incidence of their knee giving away.
That's a bad thing.
Oh yeah.
In other words, they're able to walk and do everyday life,
And their
right?
knee doesn't.
And their knee does not give out, meaning the tibia is going that way and the knee gives out. If they are only, in the past X amount of weeks, they only gave out once or less, then that's a great sign. And there's also these 2 questionnaires
Yes.
that you need to memorize. Just you don't have to memorize the questionnaire.
The
But if they
knee
score a
outcomes.
certain score on those, then that
Yeah.
means it's a quality of life questionnaire.
Yeah.
Then they're good candidates for conservative
Do you have
treatment.
to remember
What
the
is
scores?
the knee outcome
I don't know, it's in the module, everything, you know everything.
survey
Okay.
of ADLs?
What is it?
Knee outcome survey of ADLs. They have to score higher than an 80 or equal to, and the global rating of knee function, and they have to be above or at 60 in their
Yes.
self-assessment.
Great, so this person is a great candidate, and guess what? You guys are great PTAs that can treat this patient. So, we want you to teach this patient the perturbation progression. Why perturbation? Because the ACL is a ligament. Ligaments provide proprioceptive qualities. You have to retrain your patient to get his or her proprioceptive qualities back. So, let's do this properly with a therapist here. First, here is the progression. First, unaffected leg on a stationary surface and affected leg on a tilt board. So, good. And where's the therapist? The therapist will stand on the other side, not this side, because they're not gonna fall on the solid
Right,
surface.
right.
And then the therapist is gonna take their foot and apply anterior and posterior perturbation.
You ready?
Well, good, that way.
Whoa.
Not that.
Good, and the patient, this is obviously the easiest way. Then you're gonna have the patient stand up and you make it medial lateral, flip it towards me.
Oh.
Excellent, they step on there, and then medial lateral, and then finally applying perturbation, and then finally diagonal. So in all cases, the patient is still facing, remains the same direction. It's just that the perturbation changes. You see, different perturbation. So that is the first step. Good. Then we're going to progress to unaffected leg on a stationary surface and affected leg on a roller board. Do you see how this is more
This
difficult?
one's so sketchy.
So,
But this is the one where I'm standing, so it's okay.
yes, the patient is standing on it, the
Ideally,
therapist
these
is,
are the same
and then the
level
therapist
as well.
will
Supporting
take,
tips.
the therapist, either the patient does it herself or the therapist could put their foot on the board and move it. And this is more perturbation, right? It's more difficult.
then-
Good. So medial lateral, anterior then posterior, and then diagonals.
This would be done with like a slider, right?
Slide board, or, yeah, this is what I stole from one of my schools.
Whoa, allegedly.
But I stole it from one city to
Borrowed.
another city. It's still within the city agencies. All right, good.
Crossing state border.
Now we progress
need that
to
back?
bilateral
Or
on the
you
tilt
can- do you
board.
wanna
So
do
now the
that?
patient no longer has
know.
one foot on a stationary surface. They are now
Thumbs
bilateral.
up a video can.
No, bilateral.
Bilateral.
Sorry.
Bilateral.
And the therapist is guarding while he does anterior and posterior perturbation. Take your foot.
We need that still.
No,
All right.
take your foot and apply perturbation, anterior and posterior. Or you can take your foot, put it on the back of the board.
Yeah, the edge.
Put it on back of the board and push down.
Wow.
Good. You see how that's good perturbation, and then you can put it on the front of the board and apply perturbation. Then the patient gets off, does medial lateral, switch it. Same thing, bilateral, the therapist applies both ways. And then finally, diagonal. Patient gets off, puts it in the diagonal, and then there's perturbation in diagonal planes. We understand that? Good.
Well, this
And
one's
then
the
we
scary
go,
one.
from there, we go to single leg stance on a tilt board. So now the same exact thing as what we just showed you, medial lateral, anterior posterior,
Yeah.
but now it's one leg, just the bad leg. And the therapist applies perturbation for all those directions. The next step is bilateral stance on a roller board.
Do you want me to be the patient?
Definitely not me.
Please be careful.
Please guard me, please.
So, good. Now, the patient, yeah, so for this one, the patient could, you could apply perturbation, or you could have your assistant go on the floor, apply perturbation anterior and posterior
Careful.
while you're guarding.
Oh, God.
Good.
Bend your knees, bend your knees.
Good. Then medial and lateral while you're guarding, and then diagonals while you're guarding.
No.
Good.
You should have seen me, I swore.
And then we progress
Oh,
to
Jesus.
single leg stance on the roller board, the same thing. And then we progress handstand on the roller board.
She has a wedding to go to. We
Yeah,
like
right?
that breaker.
No, that's it. That's it. You don't.
Okay, you don't
same
have to do
exact thing
it.
as
All
mine.
right.
Let's
you get it,
pretend
you
it
get
was
it.
okay.
Very good.
You guys should try
You
it.
have to
Terrifying.
know this perturbation
No, thank you.
progression for the practical. All right, good. Step off.
I have a really good balance.
You have to know this perturbation progression for the practical and the written. I don't want anybody to get hurt.
Sorry.
Any questions on all the special tests, on why they saw his ACL, on why this patient was a good candidate, on how to treat perturbation? Any questions? All right, very good. Good job. Carlos, what do you want now? Case 1 or 2?
Hey.